Okay. This is, so Holly, can you hear me? We're up, the meeting will, the virtual meeting announcement is up on the screen.
Ready to
So I
go when
think,
you are.
so we can go ahead and move to the, I guess uh, this is Chairman Commissioner Follansby. I'm going to call to order the Health Service Board Governance Committee virtual meeting of February 6th, 2023. According to my computer clock, it's 2:07 or maybe 2:11 p.m.
Thank you, Chair Follansby. Agenda item number 1 is called to order, and we'll say that it's at 2:08, 1 minute ahead of you, Commissioner Follansby.
Okay. So we can move to agenda item number 2.
Agenda item number 2 is roll call, starting with Chair Follansby.
Present.
Commissioner Scott.
Present.
And Commissioner Vansky will be joining us shortly. With that, we have quorum.
Okay. We can go to agenda item number 3.
Agenda item number 3 is general public comment, which is an opportunity for members of the public to comment on any matter within the board's jurisdiction that is not on the agenda, including requesting that a board place a matter on a future agenda item. So I'll be displaying our instructions and reading them aloud. Is everyone able to hear me?
Yes.
Yes, maybe, yes, we can. This is Chairman Follansby again, and just remind callers that that the comments should be pertinent to the responsibilities of the governance committee, since we have a regular board meeting on Thursday, which will allow for general public comment on all matters regarding the health service board's responsibilities.
Thank you for the clarification, Chair Follansby. I'll read those instructions now. Each speaker will be allowed 3 minutes to comment in length unless the committee chair deems new public comment time limits during the meeting. All public comments are to be made concerning the agenda item that has been presented. A caller may ask questions of the policy body, but there's no obligation to answer or engage in dialogue with the caller. For those callers on the line, when I welcome you on the call, you're encouraged to state your name clearly, although you may remain anonymous. I'll give you an audible warning when there are 30 seconds remaining, and when your 3 minutes have ended, I'll thank you for your call. You'll be placed back on mute, and the moderator will unmute the next caller. Remote viewing is available online using WebEx. Opportunities to speak during the public comment period are available by dialing the number on the screen. The dial-in number is 415-655-0001. Again, 415-655-0001. When prompted, use access code 24890380169. Again, 24890390169, then press pound. You'll be prompted to enter a webinar password, which is 1145. Again, the webinar password is 1145, and then press pound again. You'll enter the meeting as an attendee on the public comment call line and dial *3 to be added to the public comment queue. When the system message says your line has been unmuted, this is your time to speak. For those already on hold, please continue to wait until the system indicates you have been unmuted. And I'll be moderating our meeting today and looking to see that there are no callers in the public comment queue at this time. I'll give a 5-second pause for any callers to raise their hand for public comment at this time. Seeing that there are no callers in the public comment queue at this time, public comment is now closed.
This concludes agenda item number 3, so we move to agenda item number 4. Actually, this is number 5. Did I miss? I'm confused now.
Nope, there's an error on the slide. So you are correct, Chair Follansby, agenda item number 4.
Okay, thank you very much.
I'll have that corrected. So agenda item number.
Yeah, agenda item number 4. This is number 5 on the screen, which is to review and approve the 2022 annual board self-evaluation. And I'm turning this over to Board Secretary Holly Lopez for the presentation.
Thank you, Chair Follansby. So agenda item number 4 is the review and approve the 2022 annual board self-evaluation report presented by myself. And I'm seeing something, just hang on 1 second. I see why the agenda item number 5, it is out of order. Chair Follansby, I'm going to go by the publicly posted agenda, which is
Yes.
agenda item number 4 is the review and approve the 2022 Board Education Report and Education Plan for 2023. This is a
Yeah,
draft.
let's do, we should do that. I totally agree. So we'll go back to
Okay.
the true agenda item number 4.
Yes. Thank you. One second. I'm going to update the slides that we're seeing publicly. Hang on.
It looks like Commissioner Savansky has now joined the meeting.
I
Thank you.
think I'm here, but I can't see anybody.
We
And
can't
that's
see
okay.
each other today.
We can't, but we can hear you just fine, but there is no video at the present time.
Got it. Thank you.
Thank you for joining. So we're going to agenda item number 4. We've been through the call to order, the roll call, you will be added, and the general public comment, and there were none. So we're going to agenda item number 4, which is to review the board education plan, which is an action item.
And I'm calling that up in just a moment. I'll be screen sharing that presentation.
Stop. Dexter, stop it. Stop it.
I believe that's coming through now. Is that correct?
It is.
Yes.
Yes.
Okay. Wonderful. So we'll be reviewing the 2022 Board Education Report and Education Plan for 2023, starting with the experiences that were offered for the Full Health Service Board in 2022. There were 4 education opportunities, dates throughout the year, which is the top table that we're seeing. It began in April of 28th of 2022, which you'll recall was the Strategic Board Special Meeting, where we had 2 presenters, topics on primary care and mental health. Then in June, there was 2 presenters as well on geriatrics, one from retiree health and one was an overview of geriatric strategy. In August, there was a presentation about genomics and high drug cost. That was from a subject matter expert from Aon, our partners at Aon. And then in November, there was a presentation by an outside expert, addiction services, including medication-assisted treatments by Eric Haram. So those were the board education agendized items. Within 2022, there was also the self-study education hours. These were opportunities on top of and outside of order of self-study that commissioners were able to accomplish. And so we see that Chair Follansby had calculated those hours and offered those up. And then all commissioners were able to participate in the Commissioner Citywide and SFHSS required trainings. Last year, there was 4 total. These were virtual and presented through the SF employee platform. These were included the whistleblower training, the bystander training, and harassment prevention training, along with HIPAA training. So there was quite a few offerings this year, and I'm happy to say that the commissioners were able to participate in all those offered. Next slide. Well, actually, I'll go back for a second. Were there any questions on this slide?
I would just like to comment that we don't set any kind of recommendation for self-study education hours. My suspicion is that actually this is underreported by commissioners, that all of you are doing a lot of reading of some of the weekly and monthly and sometimes daily offerings that we list in our as a resource. And I think that I was the only one who actually reported, but I just want to note that I think that other people obviously have hours and we just don't mandate what the reporting nor a minimum amount. So I want to congratulate everyone for their self-education, which is evident in our discussions, I think, throughout the year.
Thank you, Chair Follansby. So next slide. Shares the education plan for 2023. So these are topics that were reported from the board's education survey. The top three that were reported were the first being healthcare cost trends, the second was equity data reporting, and the third was data transparency. There were also a section on the board evaluation where commissioners could suggest further topics to explore during the upcoming year. One of those were adding a resource, an education resource called Modern Healthcare, which could be added to the governance terms of reference. We have an appendix for all of our resources. And then there was a second suggestion that noted that new board members, when they're newly appointed, need to complete the fiduciary training. So that'll be noted for myself when we're onboarding any new commissioners, knowing that we will have a new commissioner joining us from the Board of Supervisors appointment coming soon. And then just as a reminder, the full board will receive fiduciary training every 3 years. So the next training would be in 2024. And so in combination with the topics that were ranked and the suggestions, that will lead into our scheduling for 2022. And then whatever is decided here today from the committee will be uploaded into the board education web pages and the full board education plan. Are there any questions on this?
None from me.
No, I don't have any
Oh.
questions.
Damn it.
For commissioners, I am hearing some background noise. I'm going to make sure that our mute, all of us are muted unless we unmute ourselves. So hang on one moment. And Commissioner Scott, I'm not sure if I interrupted you, but go ahead.
No, I was saying, no, I don't have any further comments or reaction to the education plan for 2023.
If I may, Commissioner Follansby, we can address this now or later, but in the board evaluation, there is a comment about conferences and speakers, which to me is sort of a methodology of how we do educational plan. So I just wanted to call that out, that I wasn't sure what to do with that comment in terms of the board's evaluation, but there may be a crossover that we can come back to.
Okay, thank you. Commissioner
Chair,
Savansky, did you have any additional comment? You're logged in twice, it looks like now on my
No,
screen. But
I am logged in twice and now I'm echoing. So I apologize. I'll figure out one of these to eliminate. And I apologize for the background. I'm staying on mute, but Dexter is, I don't know. He doesn't want to sit still. Okay, I'll keep myself mute, and I have nothing additional to add. Thank you.
thank you very much. You can go into the next, is there another slide?
Yeah, so the next portion and the next few slides will actually go over the 2023 to 2025 education plan. So these results from the evaluation survey feed into that. So the next few slides will detail the fuller plan. And so the board education plan does run concurrent with the strategic plan, SFHSS strategic plan. So these are the goals that were newly adopted last year and that will be implemented throughout the education plan in the coming years. So those 5 goals that we've seen very recently and will be coming back to. And for the Health Service Board education goals, these were lifted primarily from the terms of reference and policies. And the 5 that stand the strongest are: 1, that the board will uphold and have appropriate education across the fiduciary duties. And like we said, that training for the full board will come in 2024. The past presentation that the board received was in 2021, and that's available at all times for any references. The second goal would be under health and welfare plan design and funding. The third would be benefits administration. The fourth are general provisions, knowing that they're references, but can be have a deep dive at any point. So those are the governance policies in terms of reference, as well as the city charter. And that's in one document accessible on the website. And then being able to have the legislative and regulatory changes affecting SFHSS members to be available to the board members, and as well as actuarial services. The last would be to complete any of those citywide and SFHSS required trainings. And that comes through the support of myself throughout the year to make sure that those deadlines are met. And as far as the methods and being able to support the board members in reaching those goals, this is where there's options of how we want to enact that. So as Executive Director Ant was just saying, that can be through conferences, workshops, and forums. There's meetings of other associations that commissioners can attend. And then we offer the in-house educational services or seminars or briefings. That's what we hold at the regular board meetings. And then as well as sharing relevant periodicals or journals so that there can be those self-study hours. And these would all be shared through the SFHSS management and funneling through me as well to the board members. And then just as a reminder for the board education goals, the annual reporting starts January 1st and it ends on December 31st. And there are reminders and submissions throughout the year that I'm available to send to the board members. And then just as we are doing now, there will be an annual report each year. So as this is an action item, the recommendation is to approve the Health Service Board Education Report without the hours and the self-study that we've seen just a few slides back, and then as well as the education plan that will carry us from 2023 to 2025. And with that, I'll stop screen sharing and open it up for discussion or questions.
Great. Thank you very much. And thank you, Holly, for really putting this together in such a cogent and logical form. So with that, we'll open this up for any comments or discussion.
Mr.
Mr.
Chair, may
Chair, I
make
would
a
move.
motion to put this on, open this for a ballot vote.
Okay, so I think it's fine. I think President Scott, you were going to move something.
Yes, I was going to move that we approve the 2022 Board Education Report and the Education Plan for 2023 to 2025.
Second.
Oh, it's been moved and seconded. Now we'll open this up for any further discussion.
Thank you, Chair Founsby. I'll display our public comment.
Any discussion from the commissioners or anyone else on the line, it's in the meeting right now, then we'll open this up for public comment. So any other comments from commissioners at this point? Hearing none, I think we can go ahead and open this up for public comment then.
Thank you, Chair Founsby. So each speaker will be allowed 3 minutes to comment in length unless the committee chair deems new public comment time limits during the meeting. All public comments are to be made concerning the agenda item that has been presented. A caller may ask questions of the policy body, but there's no obligation to answer or engage in dialogue with the caller. For those callers on the line, when I welcome you on the call, you're encouraged to state your name clearly, although you may remain anonymous. I'll give an audible warning when you have 30 seconds remaining, and when your 3 minutes have ended, I'll thank you for your call. You'll be placed back on mute, and the moderator will unmute the next caller. Remote viewing is available online using WebEx. Opportunities to speak during the public comment period are available by dialing the number on the screen. The dial-in number is 415-655-0001. Again, 415-655-0001. When prompted, use access code 2489-038-0169. Again, 2489-038-0169. Then press pound. You'll be prompted to enter the webinar password, which is 1145. Again, the webinar password is 1145, then press pound again. You'll enter the meeting as an attendee on the public comment call line and dial *3 to be added to the public comment queue. When the system message says your line has been unmuted, this is your time to speak. For those already on hold, please continue to wait until the system indicates that you have been unmuted. And I'll be moderating our public comment call line and check to see if there are any callers in the public comment queue at this time. We have 0 callers on the public comment queue at this time. A reminder to all callers on the line, you must dial *3 now if you want to join the public comment for any specific agenda item, this specific agenda item. We'll wait 5 more seconds and then close public comment for this agenda item. So there are no further callers on the public comment call line at this time. Seeing that, public comment is now closed.
Great, thank you very much. So it's been moved and seconded that we approve the education plan as outlined, including the strategic plan, educational goals for 2023 to 2025. Call for a roll call vote.
Roll call vote starting with Chair Follansbee,
Aye.
Commissioner Scott,
Aye.
and Commissioner Zmansky.
Commissioner Zmansky, you're muted, so you may want to unmute yourself.
And Commissioner Zmansky, I can try to unmute you. Commissioner Zmansky, you can try to unmute yourself now. Seems that Commissioner Zmansky is.
Wait a minute. Unmute me? Did it unmute?
We're
Good.
hearing
Yes.
you. Yeah.
I apologize because I tried to get out of being in here twice. Yes, I vote aye. Thank you.
Okay, so it passes unanimously. Thank you very much. If we could, we'll close agenda item number 4 and move on to agenda item number 5.
Okay, thank you very much. We'll just pause for a second. I'm going to reload our screen. It's taking just a moment. Thank you for your patience. Is that coming through with everyone?
Just a remote access information, not the agenda item number 5.
Okay, give me one more moment.
Again, the remote access information, there you go.
Okay, thank you. So we can move on to agenda item number 5, which is the review and approve the 2022 annual board self-evaluation report draft. This is an action item, and I'll be presenting this as the Health Service Board Secretary.
Good, thank you.
So the annual Health Service Board self-evaluation began in, this is a little bit of a timeline, it began in November. The survey was conducted in December of 2021. And as in past years, there are 4 areas of the evaluation: the governance structure and policies, the board member interactions and meeting activities, goal setting and communications, and the board's interaction with management. And just as in past years as well, there was a 100% completion rate.
And I'll just point out that because we were missing a supervisor on the Health Service Board, that 100% completion was the 6 other commissioners.
That is correct. So the full board this year was included 6 commissioners. Thank you, Chair Follansbee. So we'll start with the executive summary high level. So there were 36 questions total. 27 of those questions had an increased rating this year. 2 questions had a decreased rating, and 6 questions remained the same. And what we're seeing on the screen as well in the table is the year over year from 2020 to 2022. and the highest jump being with the governance structure and policies of a score of 4.75. And now we'll go through each section to see the details of those ratings. Starting with the areas of improvement from 2021 to 2022. We do look at the improvement areas or possible areas of concern for 2022 and those are indicated by any decrease points of 0.3 or higher. And it's good news to say that there were no statements in any of the 4 categories with a decrease of more than 0.3 points. Which helps us move right along into the areas of possible concern or focus highlighted in 2021 and what those increases were. So the board in 2021 did call out under the board members' interactions and meeting activities that all under the question of all board members adequately contribute to discussions and deliberations. There was a decrease from 2020 of 4.4 to 2021 of 4.1. So the board decided to take that on as a focus last year. And with good ratings in 2022, those scores did increase back up by 0.3%. And in areas that showed the most significant score increases, these are across the 4 categories. And I won't go through every single one of them, but you can see that in every single category, at least 2 questions had a point increase. With the most significant being from the board members' interactions and meeting categories, that second table right there, there was 5 questions total that had an increase across those questions. From the years of 2021 to 22. Now we'll go into the specific results of the board evaluation, starting with the governance structure and policies. So I'll let our eyes just sit on this table a little bit for a moment, and then call out some of the comments or highlights that came with each of these scores. So what's noteworthy is that the board rated this area the highest of a 4.75 out of the total 5. And the scores increased from last year in all 7 categories. And that was an incremental range from 0.1 points to 0.97 points. So pretty substantial. And the category that had the 0.97 points increase was the question of the board's continuing education program equips its members with the knowledge they need to be effective. So that was something a highlight that the board took seriously last year and was able to see those results. Something else that jumps out is the question with the one comment of 16.67% of neutrality, excuse me, it's the same category. But it does have a comment of neutrality, although 83.3% strongly agree with that category. The next category to point out with comments was the board receives information and reports that are necessary to carry out its duties. So this saw a 0.13% increase this year, and 2 comments support that score. One of them being there are robust mechanisms to assure adequate education, update policies, acquire background information to carry out its responsibilities, including those fiduciary responsibilities. And the second to support this score was tracking changes in the administration and policies and practices of health benefits, especially during a pandemic, have been significantly helpful. So this is, an example of how the comments from the evaluation really do help support the scoring. The last noteworthy comment in this section that didn't necessarily apply to a specific question was there was a comment saying the board did a great job in participating in the Medicare RFP process. So this was a process that took place mid-year last year to see if there was going to be a forthcoming RFP necessary. And I'll move on to the next section, which is the board members' interactions and meeting activities. So these scores increased from last year. 8 out of the 12 areas increased, and there was a notable growth of 0.5% points, and that was associated with the question of board members understand when it's appropriate to act in that fiduciary responsibility. The next question that jumps out in this table is there is a comment with a 16.6% neutrality rating, and that was the board effectively manages board members who fail to act in accordance with the policies. And one comment that stood out was shared, I am unaware of any board members who failed to act in accordance with policies. So I'm confident that if there was an instance, the board would effectively manage the situation. And this sort of calls out that it may be unaware of board members falling outside of policies if it's not brought up as a discussion point in a health service board meeting, which may indicate why there was a neutrality rating in this section. Although not associated with any specific question, there was a suggestion in the comments. Sometimes health service board commissioners might benefit from reminders to staying on topics during discussions. And this may be attributable to our shortened time frame now in our health service board city hall room meetings. So it's something to consider for the board if an area to focus on for next year. And then at the last comment for this section is that this section had as a whole, the total average was a 0.2% increase from 2021. So in 2021, it was 4.3, and this year it moved up to 4.5.
Can I just, Holly, the last line, can you go back one slide?
Mhm.
The last line, the board carefully deliberates before taking action. I think we can figure out
Yes.
based on what else is 4.67, that 33.3% agreed and 66.67% strongly agreed, but it's left blank. We may want to fill that in.
Absolutely. That's an error on my part. I can fill that chart in. And so we have the accurate information. Yes. I can get that before we present to the full board on Thursday.
That'd be great.
All right, the third section is the goal setting and communications results. So again, I'll let our eyes sit on the table for just a moment as I call out some highlights from the survey. So with this section, 6 out of 8 statements received increased scores, again, ranging from 0.17 to 0.63. And that highest increase went to the question of the board communicates effectively to service providers. And that received a 4.83, which was a 0.63 increase from the 2021. Now the two questions in this section received a rating of disagree. And so there are some comments to support some insight on that. For the board communicates effectively to plan members. There was a comment saying the board communicates, these two questions received the disagree, and there's comments to support both of those. So one of the comments was, these are odd questions because the board does not have a direct contact with plan members and the board doesn't directly communicate with the city. The board communicates the concerns through the staff that are assigned or through the board of supervisors that is a member of the commission. So it may be noteworthy, again, for the board to consider a focus for next year is how these questions are phrased and how exactly the board communicates to the members or to the city. Something
Well,
you can consider. Yes.
Commissioner Follansby, or I would posit that we have, as a board, communicated to the city directly as a full board over the years. There hasn't been an instance recently where we've had to do that, but we have in the past communicated via letter to the Board of Supervisors and or the mayor. We've done both of those things in my service on this board.
I would
Yeah,
agree.
Mr.
And I also would agree that, we do, in the annual report, there is a statement from the board regarding the board's, role that goes out to all plan members. So, which is a direct communication. I do think, though, the point is well taken in terms of trying to define the intent of this question. And it may
Yes.
be that this should be something that should be discussed at the board level in general regarding how we communicate so that not only are the board members aware of how they communicate with the plan members, but also how they communicate with the city, but also the reverse, how members are aware of, how they communicate back to the board. Because we do get communications, and then and we have a whole system involved how we address concerns of plan members that are directed to us. And this probably needs to be reviewed publicly so that there's clarity about this. And if there's room for improvement or modification, we can discuss that at the board level. But I do agree with you that there are mechanisms that are in place, and we don't necessarily advertise them, a lot, maybe, and maybe we should improve the communication in terms of what we can and do. But these comments are noted, and I think should result in some discussion at the board level. Any other discussion? Commissioner Savansky, do you have any additional insights or comments?
I would agree with that. I always thought that we communicated to the city, but mostly through our executive director, through the president of our board, and through the member who comes from the Board of Supervisors, that at least through the Board of Supes and through our director, that there is direct communication with the city. But I think we need to look at perhaps the terminology. So I would agree we should review that so that we're clear on what is meant by that communication effectively to the city. And also to plan members, because I believe through the information that goes out through our department that we are communicating with our plan members. We communicate for open enrollment, and that's a massive time of year when there's many communications going back and forth, and that we effectively communicate with our plan members. So I think we need to review this and make sure we're all on the same page with regard to the terminology and understanding. Thank you.
If I could just add in as well, certainly during I'm in my second 5-year term as a commissioner, and there's been marked improvements in the effectiveness of communication with the plan members through better documentation of the communication that plan members send to us and how those get handled. And there's a lot more accountability in that than there was initially, because I think effectiveness means that individual board members are not individually making decisions or comments to individual plan members about the health service system, but it is done through an organized, effective strategy. And I think there's been marked improvement over the years in that as well. And so I think that, again, this is just a topic that warrants some more discussion at the board level.
If I may, Commissioner Fallsby, 2 comments. One is the most formal communication we do on your behalf is to the mayor and to the Board of Supervisors in the annual budget cycle, as well as the presentation to the rates and benefits, which is a voluminous, extraordinary report that is put together on an annual basis. And then as for the HSS communications, I appreciate your comments and note that you have in the last 2 years received annual updates on the communications plan and our ability to perform related to that. So there has been indeed a more formal presentation, I think, than may have been done in the past regarding what our communications plan is.
So I think that highlights, again, in both categories, the issue of effectiveness. It would not be effective from my standpoint if individual commissioners communicated with the city over a budget sort of as an individual, that we do it as an organization, as a board. And so I think that the key here is the word effectiveness, and some of the discussion should have, revolve around what's effective communication and what is maybe not necessarily so productive. So thank you. Any other
Commissioner
comments?
Follansby?
Yeah.
Commissioner Follansby, there's one category that's not listed here that is an unofficial kind of communication, but we have the city unions, especially the SEIU 10-1 and IFPTE 21, and then also the retired employees of the city and county, plus the VPOA and the retired fire. And these are probably the most active member organizations that are not official with regard to our communication, but those are communication outlets where members of the system who belong to those organizations, there are those who have responsibility within those organizations and share information as well. So sometimes what we're doing is helping to redistribute and re-emphasize the communications that the department is already sending out to members. And maybe we can have some discussion at some point as to where we can include those as unofficial communication sources. Just a thought.
Yeah, and we do now, and we group them in as stakeholders, and do attend to communications there as the need arises.
Okay, so we're in that category as stakeholders?
Yeah.
Great. Thank you, Abby. I appreciate that. I didn't realize that. Thank you.
Any further discussion on this table 3? Hearing none, Holly, can we move on to the next?
Yes, thank you, Chair Fonsby. The next and last section is the board's interactions with management. And I'll let us view this for just a moment before we take a deeper dive. And so in this section, the scores, again, as in the others, increased last year. On this section, 8 out of the 9 statements increased their scores, and the total score went from 4.2 to 4.5. When we look at 2 of these sections, we see the 33.33% of the board members rated neutral on the statement. The board ensures management has the necessary financial and human resources to achieve the organization's goals. There were 2 comments that brought insight. One was the board does not have control over financial resources, and 2, that the board adopts the budget, which hopefully addresses the personnel and financial needs. So again, this may be a question that needs a little bit more understanding or clarification on what control the board, what financial resources the board does vote or control. Chair Fonsby, I'm not sure if you had any comments about that.
No, I read those comments and I concur on this item with your assessment.
Okay. So yeah, an area of focus that may be clarifying this question in future surveys. So the other area, oh, I'm sorry, did I cut someone off?
No, just to reiterate the fact that, again, this is our fiduciary responsibility, and we do have fiduciary responsibilities, and we defer some of the investment policies, to the city, et cetera, but we ultimately do have responsibility, and have reviewed that. And so it may be that in light of this question, we need to review is fiduciary education every 3 years adequate for the board members? And I would have to review again the issue about the orientation, but I seem to think that it was part of our orientation already, at least to some level. But I'd have to review the orientation program as well in that regard.
It was refreshed with the Chris Sears presentation in August of last year. So
yes.
So the orientation has been refreshed. We just haven't had anybody to orient since we did.
Right. Good.
Well, I would suggest that we mark this one for maybe a slight tweaking in the wording as we did the other 2 in communication. I think if it had said something to the effect that the board assures management has the necessary financial and human resources to achieve the organization through the budget process or something like that, if we make a reference to the budget, that's where a lot of this is done. It may mean it gets addressed through that mechanism. Both,
And also, you go ahead. Yeah, I'm
so,
sorry, I didn't
so
interrupt.
I'm just saying we might need to just tweak the wording on this, and it would get at the issue, I think.
Well, but the human resources, I think that the director's report every month,
Yes,
gives us an update on vacancies and recruitment and all that, which is
right.
part of this as well. And so either, we separate it into a separate question about human resources so that we can refresh our memory that each month we get and we ask questions directed to the director about what's the toll that this is taking on the
Yes.
current staff and what's the time frame and all that. So I think sometimes you're absolutely right. These questions may be in some people's mind a little vague about what's happening, whereas I think actually they do happen. I
Yes.
mean, so anyway, so we can either highlight this in the discussion at the board meeting or tweak the wording or separate the wording or whatever we seem fit in a future governance committee meeting.
Or we might take financial/budgetary, which sometimes when you think financial, you're not necessarily focusing on the budget.
Yeah.
And maybe just connecting that might be an option.
Okay. We can take this in consideration for another governance committee meeting. And then, Holly, do you want to move down to the effective management succession planning?
Yes, it's another question that came up. That 16.67% of the board members expressed disagreement and 16.6% of the board members expressed neutrality around that statement. Where feasible, the board engages in effective management succession planning. And so one comment stated that to their knowledge, the succession planning has never been a topic of discussion with the board. And it's noteworthy that this comment came up in the 2021 survey responses as well. And so there may be a need to check with the reference for governance policies in terms of reference. But it does seem, as in this category, that there may be a need for clarification in the question itself. And I'll turn it over to Chair Follansbee.
Yeah, from my standpoint, this really deals with really one position, and that's the executive director. Because succession management, succession planning, in other categories is not something that the board, we get reports on, but it's not something that we have responsibility for, I don't think, unless I'm being too narrow-minded about this. So this, I think, really is directed to the issue of the executive director. Am I mistaken?
I believe you're correct. At least that's been my experience for all the years I've been on the board. And we have, as a board, we have taken that responsibility very seriously. I've been through a number of executive directors over my many years with the board and know that as a board, we've done national searches. We've done some pretty extensive work on succession, on efforts to find the correct and the best directors that we could find for our system. So I think this needs a little clarification because it's really only the executive director that we have responsibility for. And hopefully we choose well so that our executive director then has management succession planning for the rest of the executive staff and the whole office, actually.
I would concur with that, Claire, very strongly. So this again might mean that we're talking about, it says we're feasible, but engages in effective, we should probably say executive director succession planning where needed or
I
when
concur.
needed or something like that. So again, I think it's a matter of tweaking it because beyond that, we are informed and by the executive director for the other key executives of the agency in terms of their hiring and the screening and all the rest of that. That's been a part of the executive director's reporting to us.
Plus, we're part of a civil service system
Yes.
so that, with the exception of the executive director where we do that kind of search, I believe everyone else has to go through a civil service process and the civil service department. And candidates are then referred to us, and not to us, but to the executive director and to whatever the team would be that would select for those positions. So I think we have to tweak this. You're absolutely right, Commissioner Scott.
I think that we can note that in the minutes of this meeting for future reference and highlight this in the summary report to the board on Thursday.
Yeah, if I may, Commissioner Fonsby, I would suggest that you make it a part of the executive performance appraisal, because in my mind, since day one, I've thought about succession planning, and I think all
Yes.
executives can do that. And so to have that as an opportunity on an annual basis to understand the thinking of and the activities that have taken place over the last year, I think are is prudent.
Yeah, and I also think that, again, we have to be careful because we don't need to get each executive director to commit each year to some arbitrary term or process or
Right.
whatever. So this is up to the individual in conjunction with, and I know you carry on these conversations with individuals, including board members, but it's not a public issue, frankly, from day one.
Right. And one always plans for the planned exit as well as the unplanned,
Exactly.
temporary or permanent. So I think that we all, think about that and can communicate that, but perhaps the forum is with the evaluation process.
Mhm.
I think that's a good suggestion.
Mhm.
Okay, so Holly, can we move on? If there's no further discussion on this table 4, can we move on?
Yes, thank you, Chair Fonsby. So the second to last section is just reflecting back on the action steps that were taken in 2022 that were in place to improve the 2021 focus areas. So there were 3 focus areas that had significant areas of action taking place on them. The first one was improving the continuing education. And so last year, there was a request to bring in outside experts and span them across the year. So 6 out of those 6 board education topics that were presented were from those subject matter experts and clinical experts. And then the board received education topics and references and resources through their health service board email updates. And those were directly pulled from the appendix in the terms of reference for education resources. The second area of action was around the board focusing on the policy and strategy in addition to the operations. And so last year, the board or the governance committee reviewed the health service board policies in terms of reference in November and December of last year. And those edits and clarifications were brought to the full board last month in January of 2023. And there was a new policy that was drafted, and that was specifically around the legal settlement policy. And then the second action that was taken to support the improvement was the Health Service Board participated in the strategic planning special meeting that was around policy about the strategic planning and what would take place. So the board adopted that in the fall of last year in November. The third area of focus in 2022 was refining that survey tool. And so this committee met to review the questions and the language around the tool so that before it was dispersed in the fall. Now, the last slide. These were the comments that were pulled, and I can add to what was brought up in the discussions today, but the 3 that were noted were that the suggestion to broaden the educational platform to conferences and speakers. Then the second was to remind the commissioners to stay on topic during those board meetings. And then 3, which is what I'll be adding to several of the questions, we're reviewing the phrasing. So the 2 that were noted here about the communication to the plan members and to the city. And then I'll be adding the questions around the financial resources. And then the third one would be around the succession, or the fourth one would be around succession planning.
Great.
I think. I move that we, if there's no further discussion, I move that we approve the 2022 annual board self-evaluation report as edited and discussed.
Second.
It's been moved and seconded that we approve the annual board self-evaluation as presented and modified. And so I'd like to, any further discussion from committee members? If not, hearing none, I'd like to open this up for public discussion.
Thank
Public
you, Chair.
comment.
Thank you, Chair Founsby. I'll display those instructions and be reading them aloud. There we go. So each speaker will be allowed 3 minutes to comment in length unless the committee chair deems new public comment time limits during the meeting. All public comments to be made concerning the agenda item that has been presented. A caller may ask questions of the policy body, but there's no obligation to answer or engage in dialogue with the caller. For those callers on the line, when I welcome you on the call, you're encouraged to state your name clearly, although you may remain anonymous. I'll give you an audible warning when there are 30 seconds remaining. And when your 3 minutes have ended, I'll thank you for your call. You'll be placed back on mute and the moderator will unmute the next caller. Remote viewing is available online using WebEx. Opportunities to speak during the public comment period are available by dialing the number on the screen. The dial-in number is 415-655-0001. Again, 415-655-0001. And when prompted, use access code 2489-038-0169. Again, 2489-038-0169. Then press pound. You'll be prompted to enter the a webinar password. The password is 1145. Again, the webinar password is 1145. Then press pound again. You'll enter the meeting as an attendee on the public comment call line and dial *3 to be added to the public comment queue. When the system message says you've been unmuted, this is your time to speak. For those already on hold, please continue to wait until the system indicates that you have been unmuted. I'll take a moment to notify any of the callers in the public comment queue at this time. We have 0 callers on the phone line right now. So 0 callers have specifically entered the public comment queue. A reminder to any viewers listening, you must dial *3 now if you want to join public comment for the specific agenda item. We can wait 5 more seconds for anyone to join the queue. Seeing that there are no callers, their public comment is now closed.
Thank you very much. So it's been moved and seconded that we approve the 2022 Health Service Board self-evaluation and executive summary with modifications. I will call for a roll call vote.
Thank you, Chair Follansbee. Roll call vote, starting with Chair Follansbee.
Aye.
Commissioner Scott
Aye.
and Commissioner Zbansky.
Aye.
Thank you very much. It passes unanimously. So we'll go on to agenda item number 6.
Agenda item number 6 is to vote on whether to hold closed session to review and approve 2022 Annual Employee Performance Evaluation Draft Report. This is an action item and will be presented by Chair Scott.
No, Chair Follansbee.
Oh, excuse me. Excuse me, Chair Follansbee.
That's okay. Unfortunately, we don't have the capability to record as mandated the closed session to review the 2022 Annual Employee Performance Evaluation draft, which is an action item. So we will need to postpone this according to our terms of operation, and we can do this. It's an agenda item already on this Thursday, the Regular Health Service Board to hold a closed session regarding this performance evaluation. And we can combine today's activity with that activity on Thursday, according to our city attorney. So with that, I'm going to postpone agenda item number 6 and the related agenda items until the meeting of the Regular Health Service Board on this Thursday, the 9th of February. So I think, Holly, we can move to, I think the last agenda item is to adjourn. So with that, I think unless there's any other discussion, we will go ahead and adjourn. Any other discussion before I adjourn?
Yes, actually. And
Yes.
I don't know, Chair Fallonsby, if this should come up here at governance, but I received an email informing me that the issue of public comment on these kinds of WebEx or Zoom meetings that the city would hold, including the Board of Supervisors, would be eliminated. That the only public comment that would be allowed would be in-person public comment at meetings like of the Board of Supervisors. And then I was trying to figure out if that also meant at commission meetings like ours. I think this is a very serious issue. I realize that for many of our meetings, this takes time and some people are impatient about it, but I believe that the public comment option is significant and should not be removed from the Board of Supervisors for any of those attending remotely or for any other commission meetings where the meeting may be totally remote or partially remote. It just seems to me that public comment was added some years ago for very good reason, and we should have some discussion about that as a health service board, especially because we're one of the two, actually three, benefits boards that directly serve city and county employees and retirees. And I think we have a special obligation to make sure that public comment is always an option for all of our meetings. So I don't know where to bring it, but it's my intent to at least bring it to us to then put forward to our full board meeting to have some discussion about this and to learn more about the proposal to eliminate it from the Board of Soups and other major committee meetings. Thank you.
Thank you very much for bringing that up.
Commission meetings.
I think that what I would like to do is maybe defer this to our board secretary and our executive director. And then maybe Abby, you can on Thursday, as part of your executive report, since you will be announcing that as of the 1st of March, there'll be no hybrid board meetings. Maybe you can clarify this issue for everyone at that meeting. Is that possible? Hello? Holly, Abby, are you still on the line?
Yeah, sorry, I didn't hit my mute button. Yes, and I'll be sitting next to my colleague Jennifer Donlin, who
Yes.
has reached out to each of you to understand what your questions might be for the changes that are coming. We will still have public comment when we're back in the real world. It will not be virtual. But there will be public comment. So please, unless I misunderstood you, Claire, we are not doing away with public comment. We're doing away with virtual meetings. And on occasion, there may be a reason to do a hybrid meeting, but there's some pretty high bars to meet to do a hybrid meeting. And so I think we'll be more like we were before the pandemic than we are like we are today.
Members will still be
I'd
able to
like some
call in, right?
clarification, right?
I mean, won't they still be able to call in their comments? It won't be a virtual meeting in the same sense that we've had, but there'll still be an opportunity for them to call in. Is that not correct?
It's not my understanding.
Well, I
I believe
think that
that's not
is,
correct.
I think that was the thrust of Commissioner Zavansky's comment, if I understood her. It
Right.
was not, it was the fact that we would be going back into in-person meetings and whether we could continue to have virtual public comment. That's the question. I think that it was a thrust of the comments that she was making. Am I
Correct. Yeah.
correct? Commissioner
you-
Savansky?
You are, and that would also mean that, many commission meetings are all on sfgov.org. And so when we can't attend, as I often attend the retirement board meetings, I do it through sfgov.org. And I can also call in during public comment. And so my concern is whether or not that option is going to remain available, especially for our board, like the retirement board as well, and the other quarterly retirement fiscal board, because the initial information I received focused more on the Board of Supervisors and other hybrid meetings. And Abby is correct. The threshold, I believe, has changed and increased significantly. So I doubt there will be very many hybrid meetings in the future. The idea is to go back to in-person meetings, but the public comment is the part that needs to be protected, I believe, and I just want clarification on that for us especially. Yes.
Commissioner Savansky is Jennifer Donlin. I will take a particular look at that issue and make sure that Abby has the information on Thursday.
Thank you.
Thank you
you.
very much, Jennifer. Appreciate it.
Sure.
Okay, so before we adjourn, if there are no other comments before we adjourn, I just want to thank Holly once again for putting together really, doing a great job putting together these agenda items and draft reports and summaries that made it possible for us to logically go through each agenda item in a facilitated way. And I want to thank you again for all your hard work on that.
Thank you,
So with
Commissioner.
I concur.
with that, I will now adjourn the meeting.
3.
Thank you, commissioners. Yes, and adjournment at 3:16 p.m.
Great. Thank you very much.
Thank you.
Thank
We'll
you.
see you on Thursday.
Thank you. See you Thursday in person in Silly Hall.